This is Ivan Profit on channel 91709 News. Disease-modifying anti-rheumatic drugs, also known as DMARDs, are a relatively low-cost solution to a chronic disease known as rheumatoid arthritis, which affects almost 400,000 Australians, attacking the joints in the body, causing excessive discomfort and pain. It is known as the second most common type of arthritis after osteoarthritis. This disease was coined in 1858 from merging the two diseases, arthritis deformans and rheumatic gout. Now passing over to our journalist, Mr. Aaron, with more information.
Thank you, Ivan. I'm joined here today by head rheumatologist Dr. Lingui from the University of Technology, Sydney. Thank you for being here.
Thank you for having me.
Firstly, what is rheumatoid arthritis?
Rheumatoid arthritis is an autoimmune disease in which the body's immune system that normally protects its health by attacking foreign substances, such as invading bacteria and viruses, mistakenly attacks our joints. This in turn will create inflammation that causes the tissue that lines inside of the joints to thicken, resulting in swelling and pain in and around the joints that may eventually lead to damage of the bones and loss of mobility later in life.
Wow, sounds terrifying. How do we treat it? What do we use?
In terms of treatment, we are now utilizing DMARDs, which are disease-modifying anti-rheumatic drugs that target rheumatoid arthritis. So what the DMARD does is that it decreases pain and inflammation to prevent damage to the joints which we use in our daily lives to move around. We're currently using two types of DMARDs, biological and conventional, and their functions differ in targeting different molecules in the body. So biologics target individual molecules such as cytokines, which start inflammation in the body. Therefore, they work faster, however, are only administered to patients who have no response to conventional DMARDs.
So if I'm understanding correctly, why don't we use biological DMARDs as a first method of treatment, rather than administering conventional DMARDs first?
That's a good question, actually. Conventional DMARDs are administered as an oral tablet as opposed to biologics, which are administered through an intravenous infusion. More so, they're much more expensive, and that being said, treatment is administered with a combination therapy of conventional and biologic DMARDs.
Side effects linked to using DMARDs.
Generally, the side effects include headaches, fevers, dizziness, as the drug targets certain molecules in the body and the immune system. Therefore, it can result in a suppressed immune system and also, in rarer cases, bone marrow suppression and renal or liver dysfunction.
There are many conventional drugs for rheumatoid arthritis, although the drug of choice is methotrexate. Methotrexate is normally the first medicine given for rheumatoid arthritis, often alongside other DMARD and short-course corticosteroids to relieve any pain. It may also be combined with biological treatments mentioned. Methotrexate acts as a competitive analogue to folate-blocking dehydrocolgate reductase, preventing the formation of tetrahydrofuran and blocking purine biosynthesis, which ultimately activates lymphocytes. Infliximab is a tumour necrosis blocking agent approved for multiple autoimmune diseases. It's widely used to treat rheumatoid arthritis in paediatric patients and Crohn's disease. It functions by blocking tumour necrosis factor alpha A, a substance that promotes inflammation. This stops the destruction of joints. Patients receiving it are at high risk for severe infection during therapy, particularly if they are getting concomitant corticosteroids or methotrexate. Natalizumab is a monoclonal antibody against alpha-4 integrin approved for multiple sclerosis and Crohn's disease. This action is thought to prevent immune cells, mainly white blood cells, from crossing blood vessels' walls to reach affected organs. It was the first drug developed in the class of selection adhesion molecule inhibitors. Common adverse effects include headache, fatigue, urinary and respiratory tract infections. This drug can be obtained only through a special prescribing program.
In a recent research conducted by the researchers, it was compared with naive patients and non-responders of combination therapy with methotrexate and other biological therapies and conventional therapy. The research suggests when we mix and combine the conventional DMARDs ADA with MTX, the efficacy is higher than that of efficacy with monotherapy. This suggests an increased amount of efficacy with combination therapy rather than monotherapy.
Thank you for joining us, Dr. Lingui.
My pleasure.
Back to the studio, Ivan.
Thank you for joining us, Hep and Dr. Lingling, on this special segment on DMARD. Stay tuned for after the break, as we will be sharing the secrets on how to obtain full marks in your video presentation.